In medicine, there's one simple guiding rule that's supposed to cut through all the noise. Put the patient first. But what happens when that simple rule crashes headfirst into a really complex, messy reality? Well, today we're going to explore that exact question through a hypothetical case that tests this principle in just about every way you can imagine. So let's start with this core idea right here. This quote really gets to the heart of it. Medicine isn't just about fighting off a disease. It's about serving people, empowering them. It's supposed to be the North Star for every doctor. But as we're about to see, sometimes the path that star points you down is incredibly difficult to follow. All right, so let's get into the case. Let's meet the person at the very center of this whole dilemma. She's young, she's vulnerable, and she's facing a decision that will, no exaggeration, change the entire course of her life forever. Okay, so here's what we know. The patient is a 4-year-old girl and she lives in an orphanage. Now, this next part is absolutely critical. She's non-verbal. She can't tell anyone what's wrong. She can't say what hurts or what she wants. Think about that for a second. That means she is totally 100% dependent on other people to do the right thing for her. So the immediate crisis starts when the religious sisters from her orphanage bring her to the hospital. The reason? She has this painful red left eye. And when the doctors run tests, there's just no response to visual stimulus at all. Nothing. So right away, everyone knows this is serious and it needs urgent attention. And this is where things get really intense. The medical team is looking at a drastic choice. They're actually considering whether to enucleate. That means to surgically remove her entire eye. But here's the catch. After the CT scans and the MRIs, the data just isn't clear. The doctors themselves are divided on what to do, and the stakes could not possibly be higher. Now, as if all that medical uncertainty wasn't enough, it turns out there's an even bigger problem looming over everything, a massive legal and ethical question. Before they can even think about a treatment plan, the doctors have to figure this out. Who has the authority to speak for this child? Who can actually give consent? And yeah, that question of consent, it's not a simple answer. It quickly turns into this incredibly complicated legal maze, and finding the right person to make this choice is anything but straightforward. At the heart of this maze is a conflict. On one side, you got her grandmother. As the next of kin, she likely has the legal authority. But when they talk to her, she shows very little concern for what's happening. Then on the other side, you have the religious sisters from the orphanage. They're the ones who are actively seeking care, the ones who are clearly fighting for her, but they have no formal legal power at all. You know, the law actually has a pretty clear hierarchy for this sort of thing. It starts with a spouse, then adult children, and then what's called ascendants in direct line, which is where grandparents fit in. So if you're just going by the letter of the law, it seems like the grandmother is the one who gets to make the call. But, and this is the million-dollar question, what do you do when the person who has all the legal power, the grandmother in this case, seems to have just checked out, when it looks like they've effectively abandoned their responsibility? Does the legal structure still hold up, even if it might not be what's best for the patient? It's a huge problem. And this is exactly where we come back to our ethical compass. Because when the legal path gets this foggy, ethics has to give you a clear direction. And in medicine, that compass needle always points to the same place: patient first.
See, the whole idea is that everything, and I mean everything, starts with the patient. Normally, we're each responsible for our own health. But when someone can't be, like this 4-year-old girl, well, that's when society is supposed to step in and help. The entire medical system exists to serve the patient, not the other way around.
This is the core rule, and it's an absolute. Every other factor, every other goal, every other person's interest, it all has to come second to doing what is medically and ethically best for the person who needs care, right here, right now. So what kind of stuff comes second? Well, even really important things. Things like advancing medical knowledge or the goal of helping patients in the future. Those are good goals, but they're secondary. And of course, any kind of personal gain for the physician, that's completely off the table. The focus has to be 100% on this one child. And this brings us to how you put that patient-first idea into practice. It's through something called informed consent. It's not enough for doctors to just decide what they think is best and go for it. No way. They have to inform the patient or their proxy and get their consent. It's a partnership, and it has to be built on trust. Okay, so we've got a legal puzzle on one hand and a really clear ethical guide on the other. Let's see how you can put those two together to actually create a path forward for this child. This brings us right back to the central question for the medical team. With an uncertain diagnosis and this major conflict over who can give consent, what is the right thing to do? How can they possibly move forward?
Well, that patient-first principle actually provides a pretty clear action plan. First, the doctors need to assess if the grandmother has truly abandoned her role. Second, they absolutely must consult with the religious sisters, who are acting as the child's real day-to-day caregivers. Third, they have to prioritize the child's best interest above everything else. And finally, they have to make sure that whoever gives informed consent is genuinely, truly acting on the child's behalf.
This whole case leaves us with a critical question, one that extends far beyond this one hospital room. For patients who can't speak for themselves, children, the elderly, the vulnerable, how do we make sure their voice is always the loudest one we hear? That right there is the fundamental challenge of truly putting the patient first.